The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanik, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are gathered here for the next episode of TMD Demystified. As always, I look forward to presenting these episodes, and some episodes I spend more time on preparation than others. This one, not only have I spent considerable time in preparation, but I've delayed this particular episode for many months because I know it's going to be a difficult episode to present. I hope you bear with me here a little bit. It's difficult for me, and it may be a little difficult for you as I proceed. But it's a very important episode, extremely important episode, as far as I am concerned, and what I have learned about TMD and what I have to teach and what I have to disseminate about this problem and about the severity of it and the significance of it to each individual patient who has it and to our society who suffers from these symptoms, which for the most part have not been addressed and solved properly. The title of this episode is The Value of Treating TMD Successfully. The value of treating TMD successfully. So let me give you a little background. This is developed in many of the other episodes, and again, I am not going to spend a lot of time on any of what I say, giving references, but I'm going to talk about articles here. Anyone who is interested, you can contact me. In fact, I encourage you to contact me personally, and I'll be happy to share with you my knowledge, my references, the references of our independent study on this problem within our own practice, based on, at that time, 3,000 successfully treated patients. We now have approaching, probably, because that was more than 2 years ago, and we treat, on average 500 patients a year. We're either approaching or beyond 4,000 successfully treated patients with TMD symptoms in this practice in Middle Tennessee. That is not the point. The point I'm going to be making is the value of treating TMD successfully. I mean, specifically the dollar value of treating TMD successfully. Because some of these symptoms, which are almost pandemic in nature, bad choice of word, I think, but it is pandemic. Migraine, headaches is a pandemic problem throughout the world, but certainly in the United States. I'm going to be, and the reason I hesitated doing this is we're going to be talking about numbers, statistics, and I'll keep it limited as much as I can, but I'm going to try to make a really important point here in the next 25 minutes. And that is because some of these symptoms, and we're going to just pick out 3 particular symptoms of the symptom list. There's a list of symptoms associated with TMD, well-known, not well-studied, but well-known with TMD. I'll rattle them off again. Headache, frequent or recurring. Headache, bad headaches. Everybody's like, but they don't say bad headaches. They say, no one says I have bad headaches. Nobody, no one. Everyone says I have migraines. Now, whether that's because they've been educated that way from the internet and the television, or because that's what their doctor says or the walk-in clinic says or whatever, but no one says I have bad headaches, and no one says I have bad TMD headaches. Everyone, even if they've been diagnosed with TMD by someone else, or they use that word, I have TMJ, I have TMD, when you say, Do you have headaches? Oh, yes, I have migraines. Well, we're going to talk about that specifically. But the symptoms of TMD are frequent or recurring headaches, ear aches, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, fullness in the ears, vertigo, dizziness, upper shoulder and back pain, upper shoulder and upper back pain, arm, hand, finger tingling and numbness, and various kinds of locking. There are other symptoms which are not promoted much. We're not going to talk about that. I am finding out about these symptoms as we go along. But those are the accepted symptoms. And 3 of those particular symptoms have huge impacts on our society, medical impacts, and cost impacts on our healthcare system. Whatever you think of our healthcare system, whether you think it's the best in the world or the worst in the world, it does have a financial portion to it, the cost to it, to each individual kind of problem, each symptom, each one of those symptoms. And I've done some research. I particularly, just researched out a few things here, preparation, but we have an independent study that looked at our 3,000 patients successfully treated as to the effect of treating those patients with a intraoral device that does nothing more, nothing less than unload the temporomandibular joint to allow the inflammation to decrease, and the percentage of those symptoms that decrease over a finite number of patients. I'll be happy to share. We're going to be talking about that a little bit. Again, it isn't that these things are boring, but it does make your eyes roll back and you kind of lose the tract of what the person is trying to talk about if he gives too many statistics. And our study through Middle Tennessee State University was an independent study. I just gave them access to the 3,000 patients. The study was designed by Middle Tennessee State University. The questions to the patients on the survey questions for the study, where the questions were designed independently by Middle Tennessee State University, and the results were monitored. And then those studies are now complete, and 2 papers on that study are now out for peer review at 2 separate journals or publications. We'll talk about the statistics of that in just a minute. But okay, so let me formulate what the meat is about what I want to say. I'm not trying to prove anything. I'm going to bring actually what I have to say should elicit more interest, and actually to do some really significant studies as to the effect of treating TMD successfully versus what has been done for these symptoms. So I picked out 3 of the symptoms: migraine headaches, dizziness, or vertigo. They're similar in definition, but for our purposes, and in the study that was done through Middle Tennessee State University, they do make a distinction between the 2, but the results are so similar that they kind of run together. And then, vertigo and tinnitus. So those are 3 symptoms that I've kind of pulled things out of the literature here in the past few days, and I just want to share with you on each of those symptoms, those 3 symptoms, what the prevalence is of those symptoms is in the United States, and the numbers of prevalence, of course, is determined by studies. And there are many different studies on the prevalence of migraine headaches and dizziness or vertigo or tinnitus. But on average, looking at several studies, I'm going to give you some numbers, what the prevalence is for each one of those entities, symptomatic entities. And then I'm also going to give you some averaged numbers of what the cost is to treat those symptoms in the United States of America, averaged out over what I perceived over looking at the recent literature, cost per year of treating those symptoms independently. I guess it's time for me, to integrate into our discussion that treating the TMD by unloading the joint with an appropriate device that we call the urbanic device and protocol treats those symptoms simultaneously. So what the distinguishing factor is, I'm going to be giving you information regarding treating each symptom independently through our medical system. And then, of course, if you acknowledge and you actually diagnose a patient with inflammation within the temporomandibular joint, which is the definition of TMD, let me repeat that again. I've said it several other episodes. TMD is defined as inflammation within the temporomandibular joints, and the symptoms flow directly from that inflammation. But if you treat TMD, the inflammation properly, and you get the inflammation to go down, whatever symptoms they have on that symptom list will go down, not all simultaneously, they'll go down at different rates, but they all go down to the point where once the inflammation is diminished, you can go down that list again that the patient had 4 or 6 or all of those symptoms on the list, and they will say, yeah, they're all gone. So we're treating a symptom complex by treating TMD, where the numbers and statistics I'm about to give you actually are just directed to one particular symptom. So you can do the addition yourself as to the amount of compounded dollars that are spent when a patient has one or more of these symptoms treated independently in our medical system. So, all right, so here is the actual data. And again, if you question me and you want the references, please text me, call me, be happy to share whatever I have. Migraine headaches, migraines. And again, everybody has migraines. They don't have bad TMD headaches. They don't even say they have bad headaches. Everybody has migraines. According to the studies, 20% of the population have migraine headaches. Of course, it varies between sex somewhat, varies between race somewhat, but on average, in the United States of America, 20% of the population have migraine headaches. The average cost, again, these are done through studies, and I had one good study here that had addressed it very well. The average cost, medical cost, direct costs, these aren't indirect costs. Direct costs would be actually the dollars spent by the person or the insurance company on that particular symptom per year. Does not include indirect costs, would be, time out of work, any travel expense, any difficulties in life services that goes with having this particular symptom, like a migraine headache. You can't do anything socially. I have many ladies who say, I know I'm really a bad parent. I'm just so short with my children. The point being, there's definitely indirect costs. But the direct cost to treat a migraine headache per year, according to this particular well-done study, is $6,575 per year, per patient. I am not going to try to do the mathematics on this in comparison to treating it with an urbanic device, intraoral, non-surgical device, for which the average fee for a non-surgical TMD service within the United States of America 5 years ago, when I researched this out, was $1,800. So let's just do a little contrasting as it relates to this one symptom: bad headaches, migraine headaches, treating it in the usual and customary way that our medical system treats it versus a intraoral device that on average is somewhere between, with with the cost of increase in costs over time, it was probably well above $2,000 per year on average to treat a non-surgical TMD. Or excuse me, not per year, period. So because the device goes on forever, if you make a good device, it's not a per year, it's $1,800 or $2,000 flat fee to treat the patient because they use the device indefinitely. All right, so again, I told you this is going to be a little hard for me and hopefully not too hard for you to understand. So if you have migraine headaches and the average fees to treat that migraine headaches, drugs and x-rays and MRIs and looking for brain tumors and all kind of other things is $6,575 per year. All right, so one way to look at this is to say the patient has TMD and they get a device for $2,000 and they keep the device for 10 years. The total cost to treat them successfully once the proper diagnosis is made and they are treated successfully is $2,000. If they go through and have the problem misdiagnosed, misdirected, mistreated in our USA medical system at the average fee per year of $6,575, the total cost over 10 years would be $65,750. Obviously, you can see a huge difference between treating TMD successfully with a proper diagnosis and misdiagnosing it, mistreating it, and putting it in the medical system that uses all kinds of things that are not successful because they haven't diagnosed the problem. I've discussed many times before how easy it is to diagnose this problem by literally pressing on the temporomandibular joint glenoid fossa from the open to the closed position. If you open widely, put your fingers in the glenoid fossa and have the patient bite down rapidly, if there's inflammation in that joint, it's going to cause pain. If there is no inflammation in the joint, it will not cause pain. So you have the easiest way to diagnose inflammation within the temporomandibular joint. So you can rule in, rule out this problem extremely well. I am not saying, I have not ever said that there isn't such a thing as a migraine headache, although I have some suspicion now, some strong suspicion, because that there is actually not a migraine headache entity. The studies, as I've said before, and I've read many of them, many of the good ones, good practitioners, good scientific studies, analytical studies, all admit no one knows what causes migraines. But we do know that thousands of people say they have migraines, been diagnosed as migraines, have spent huge amounts of money by themselves or through their insurance companies on treating migraine headaches. And when you make the inflammation in the temporomandibular joint go away, their headaches, bad headaches, go away. So therefore, they're not migraine headaches. What those numbers are exactly, I don't know. I can tell you with my own observation over now 4,000 successfully treated patients that 80 to 90% of the people come in with their concept that they have migraine headaches. Not everybody who comes to see us has that symptom, but at least it's in the 90s that they, along with whatever other symptoms they have headaches. Because headaches are the most common symptom of TMD. Neck pain is the second most common symptom. So just with this one symptom entity, if you treat it in the usual and customary medical system, and it has been misdiagnosed, they don't have migraines, they actually have TMD. You go from spending $65,750 over 10 years to, something in the range of $2,000. Now, let me just say on the cost of medical care, a doctor can charge whatever he wants. put his fees wherever he wants for whatever reasons. But what the point I want to make is in the middle of the country, I have found by example and experience, in the middle of the country, the fees are much less than on the coast. On the West Coast, in California, in Oregon, in Washington, and on the East Coast, especially in New England, fees are much higher than the average that I just quoted, and that is a fact. Now, so I mean, that's a striking difference between, $2,000 and $65,000. So you can see that there is a significant value in treating TMD successfully, diagnosing it successfully, number one, and then treating it successfully. A significant difference in dollar value. And this is also addressed in the MTSU study that was done for us independently, which anyone who contacts me, I'll be happy to send you a copy. Happy to send you a copy. I am not going to quote all the details. I'm looking here at a table from this study that addresses each one of these symptoms in detail. This is a very, I think the white paper that the studies were based on, white paper on the study itself, and then these papers that were written on the white paper. I think it was 65 pages of white paper. But regarding headaches, in our case, the headache patients were divided into two categories: patients who had prior TMD treatment of any kind, meaning they had the diagnosis when they walked in the door, and patients who had not been diagnosed with TMD when they walked in the door. So prior treated patients and not prior treated patients. But the table in the study showed that of our patients, 3,000 on the basis of 3,000 patients, the decrease in symptoms of headache for the previously treated patients were 63%, and for the non-prior treated patients was 63%. And of course, that is an average, which patients claim to have decreased in their headaches using the device and protocol over a period of time. All right, so let's move on. I don't want to carry on with this too long. Let's move on to the next symptom, which would be dizziness. Study that I read, dizziness is a little harder to pin down as far as prevalence, but the study that I'm going to quote stated that between 20 and 56% of U.S. patients, U.S. population, 20 to 56% of the population complains of dizziness per year. And the average cost to treat that symptom when it is addressed in our medical system is $1,479 plus or minus $250. So again, if you do the multiplication, let's just say 20%, let's just say the lowest number, 20% complain of dizziness, and a certain percentage of those patients, actually the dizziness or vertigo is coming from the temporomandibular joint. And so you can multiply that out and you can determine that, hundreds of thousands of dollars can be spent on treating on treating dizziness over a period of 10 years versus a non-surgical device unloading the temporomandibular joint, decreasing the inflammation in the joint, which decreases dizziness. We have a huge number of patients that occurs. Back to our study regarding dizziness. In the prior treated patients, and patients come in sometimes with 10, 20, 30 years of prior treatment. I mean, it's not unusual at all. In fact, the average person comes in here between 15 and 20 years of prior treatment for these symptoms. But for the dizziness, their decrease in symptoms, 66% on the prior treated patients, and 71% decrease in symptoms on dizziness on the not priorly treated category in this particular study through MTSU. We do not know how many patients who complain of dizziness, what percentage of those patients actually it's coming from TMD. I don't know. It's a great study. That's why I say this presentation brings up many more questions than it answers. But what I'm trying to do here is make a significant statement about how much money is being wasted simply by misdiagnosing TMD. I don't know how more emphatic I could be. It isn't funny. I feel so bad for the patients. I feel so bad for our systems. I feel bad for the doctors who misdiagnose it, mistreat it, misdirect it. And they're learning here in Middle Tennessee. That's why because we address this problem and educate our doctors here in Middle Tennessee as we market this in Middle Tennessee. We have approaching 800 doctors, referral sources, separate practices, separate doctor referral sources who are now cognizant of TMD rather than migraine headaches and dizziness. By the way, before it slips my mind, there's a tripartite symptom complex of Meniere's disease, which is, as I said this before priorly, not to repeat myself, but Meniere's disease is defined as a symptom complex exclusively includes tinnitus. By the way, the proper pronunciation is tinnitus, not tinnitus. Tinnitus, subjective hearing loss, like a fullness in my ears. I can't hear it as well. Subjective hearing loss, like you have water in your ear, is the way it's described. Or I like to describe it. People go, yeah, that's what it feels like. And vertigo. Tinnitus, subjective hearing loss, and vertigo is actually the definition of Meniere's disease. And the ENTs who treat Meniere's disease, and if a PCP or a walk-in clinic or someone thinks, I think you might have Meniere's disease, you need to go see the ENT. The ENT does a several $1,000 workup, and to conclude, you have Meniere's disease. And the patient says, what can we do about it? And the ENT will say, nothing. I don't have a solution. A great number of patients who have that happen to them actually have inflammation within the temporomandibular joint. Of course, we figured out how inflammation in the temporomandibular joint gets into the middle ear through the petrotympanic fissure. Look it up. It's in Gray's Anatomy. So what percentage of patients with I'm not saying there is no Meniere's disease. What I am saying is a huge number of patients have ringing tinnitus, subjective hearing loss, and vertigo who actually have TMD. And there is a solution to TMD because you can decrease inflammation within the temporomandibular joint by unloading the joint over a long enough period of time in a proper way. It's breathtaking how simple this is when you look at it objectively. And not to belabor this long, we're running out of time here. I try to keep it to 30 minutes. And the last is the tinnitus itself. Tinnitus, 10% of the population has tinnitus, according to one study, and the average cost of treating tinnitus per year is $2,000 per year. So if you multiply that by 10 years, that's $20,000 versus 10% of that if you treat it non-surgically with an intraoral device that unloads the temporomandibular joint, decreasing inflammation. I think I've carried this and made my point as best as I can today. I really did hesitate and shied away from doing this particular episode, literally for months. I didn't know how I was going to address it. I know the points that I wanted to make. I knew intuitively how much money, dollars, are being wasted on our healthcare system. And of course, individuals pay for that one way or another. You as an individual, whether you obtain that service through an insurance plan that is paid by your company, or you pay it individually, those dollars come from individuals. The only production actually is an individual's production, and then it goes, to what the value is and what your pay is to do that. So ultimately, we all pay for our services one way or another. We all pay for our services. And so we know that this is a poorly diagnosed problem. I know that, and I should maybe do another episode on how badly this is diagnosed. But we've got this. I can't say we have it under control in Middle Tennessee, but we are well on our way to having major success and inroads in having our doctors population. And I say doctors, I mean all doctors, dentists, dental specialists, physicians, physician specialists, walk-in clinics, nurse practitioners, physician's assistants, chiropractors, who are now wising up and able to properly diagnose TMD rather than just saying you have migraines, you have Meniere's disease, and not knowing what to do with it. I just came to mind, I had a patient yesterday who was wearing a Holter monitor because her dizziness, when it occurred, made her heart rate go up, and no one could control the dizziness. No one knew what to do about it, but they thought, well, maybe it's something to do with her heart rate. And this is the second Holter monitor system that she did one in October, which was totally negative. And then she's currently wearing a Holter monitor to monitor her heart rate and system. But actually on diagnosis and history, this young woman has TMD. And when you make her vertigo diminish, she won't have any more problem with her heart rate because it won't be that anxiety produced. She said, I just went crazy when I started getting dizzy like this. My heart rate just shot up. And so the cardiologist says, well, we'll check out your heart. That's probably a couple $1,000s worth of service just to do that for somebody. I made my point. Excuse me if I've went on too long. For those out there who would like to join our program to use the Urbanic device and protocol to treat TMD non-surgically, to get the results that we get here, you have to take an online course, which is short. I shortened it up quite a bit. It's now shortened down to about 3 hours of online course so that you can get licensed to use our device and protocol. So if you're interested in doing that, you can contact our company through our website, www.tmjservices.net. As always, I encourage anyone out there who would like to communicate with me, who would like to make comments, or would like to criticize. I can be reached at tony@tmjservices.net. Again, I challenge any listener out there, please prove me wrong. I prove what I say, what I found, what we are doing here, prove me wrong, because I don't think you can, because we've had the stats, we've had the experience. And then if you'd like to talk to our Director of Marketing and Education, Naomi, she can be reached at, and she's very effective in making things happen. She can be reached at naomi@tmjservices.net. So for today, I appreciate your attention. I appreciate anyone who feels that they can contribute to the motion at solving this problem for the millions of people who we know are misdiagnosed, mistreated, misdirected on these symptoms and many more. I just picked out 3 of the symptoms. So for today, I appreciate you. I look forward to speaking with you the next time, which will be in 1 week. Have a great week. I hope you're very productive, and I look forward to speaking with you again. I am Tony Urbanic, and this is TMD Demystified.